Thursday morning. We love talking to Dr. B with People's Health, Chief Medical Officer of People's Health, as a matter of fact. And we discussed senior health, but today's topic really applies to everybody. We're going to talk about digestion. It's an important and complex system in our bodies, but it can also cause some problems from time to time. Dr. B is here. He joins us to discuss 3 common issues associated with our digestive system and how to take care of your gut. Good morning, Doc. How are you?
Hey, Tommy. I'm doing great. How about you?
I'm good. It's warm. Better than last week.
Yeah,
let's start by maybe you can explain the digestive system.
Sure. So it's a big topic, obviously. We usually spend over a month on this in medical school, but I'll try to do it in less time. The digestive system really is everything from your mouth all the way through your body. So, it starts in the mouth, goes down to your throat, and then your esophagus. From there it goes to the stomach, and then the small and large intestines. So pretty much when you eat food, you chew it up in your mouth, it actually passes into your esophagus, travels down to the stomach where acid is added to it, and that helps the digestion and breakdown of the food. And then after that, it passes into the esophagus, it passes into the small intestines where enzymes start to break things down and pull nutrients out. Then it passes into the large intestine where really mostly water and nutrients are removed. And then what's left over is what we eliminate from our bodies.
And that's what the large intestine does?
That's what the large intestine does. Mm-hmm.
So there are a lot of conditions that affect the digestive system. You see them advertised on TV all the time. I guess, Dr. B, you want to start with acid reflux?
Yeah, acid reflux is definitely the most common thing that we see. Most people suffer from it at some point in their life. And really what it is that acid that's added to the food in your stomach actually can reflux up through the esophagus back into the mouth. And so that's why a lot of times people will describe it as heartburn because it's kind of passing right through your chest. Excuse me. And it can actually cause a bad taste in your mouth or kind of a bitter taste in your mouth and a little bit of burning in the back of your throat. And it's common, but if it's happening frequently, more than 2 times a week, then we actually call that gastroesophageal reflux disease or Gerd. And that actually is very common as well. So, what we look for, some people will have bloating, they'll have that regurgitation feel. They can actually get hiccups because the acid can actually cause some irritation that leads to hiccups, and then sometimes nausea as well. One thing I like to point out to people, too, is you can sometimes get a little bit of acid that refluxes all the way up and then actually goes down into your lungs, and that can actually result in cough, hoarseness, or even wheezing. So that's something to really watch for. People may think they have a lung condition, but it's actually being caused by acid reflux.
So where does food fit into all of this or other things that can cause it?
Yeah, food definitely is probably the biggest culprit. There's a lot of foods that we eat in New Orleans that lead to reflux, which is why it's so common here. Garlic and onions and tomatoes, anything that's citrusy can really cause reflux. But in addition, things with caffeine in them, things like chocolate or coffee or tea, that can actually cause reflux as well. And then in particular, fatty foods and fried foods, and definitely spicy foods can lead to some reflux. The interesting thing, though, is there's a lot of other things we do that exacerbate the reflux or cause it, and those can be very mechanical. So overeating definitely can cause some bloating, and that can lead to a refluxing-type syndrome. Being overweight or obese definitely increases your chances of reflux as well. But also laying down after you eat can actually mechanically cause that food and acid to run back up. And then in particular, smoking can cause reflux, as can certain medications like aspirin or ibuprofen, and even some blood pressure medicines that people take regularly can lead to some acid problems. At
what point do you see a doctor about this? I ate some pistachios before I went to bed earlier this week, and I had the first problem like this in a long time. So apparently I shouldn't eat pistachios before I can go to bed. When do you know when it's time to see a doctor?
Yeah, it's really, everybody gets this, and it's triggered, sometimes by food, like you mentioned. But if you're having it consistently, definitely more than twice a week, consistently over a couple of months, then you really need to see your doctor about it to make sure that it's not something else going on.
So I knock on your door. Well, no, you don't do that, but I'm sitting in the office waiting for you to come see me, and I have acid reflux. What are you going to do to treat me?
Yeah, there's a ton of treatments over the counter. In fact, there's some of the most widely sold medications in the world. Common things like Alka-Seltzer, Maalox, Tums, Rolaids. All of those things can help reflux. And then a pill that you can take is something called an H2 blocker, the most common one being famotidine or Pepcid. And those are fine to take. They're fine to get over the counter. But again, if you're having to take them daily to prevent the reflux, then that's something you need to talk to your doctor about to make sure that there's nothing else going on.
Another common condition with the digestive system is gas, and we're going to be mature about this, Doc. I'll tell the audience. Can you tell us more about it? Because it can cause people a lot of problems.
Yeah, sure. A lot of people don't want to talk about gas, obviously, and they don't want to talk to their doctor about it, but it's really important to let us know what's going on with you. Gas is very common. Everyone has it, and it can be caused by certain foods, in particular carbohydrates. Carbohydrates, when they're broken down, that's things, that are found in dairy products or beans, fresh fruits and vegetables. Those, when they're broken down, actually can produce gas in the stomach. And that gas, if it builds up high enough, then you can actually develop some pretty severe abdominal pain. Some people will describe bloating, even, an enlargement of their abdomen. But then definitely burping, flatulence, obviously can occur as well. The pain can be extremely severe, though, and people can actually think that it's something else going on. And that's why if it's real frequent, you need to talk to your doctor about it. Something like acid reflux can lead to gas as well. But then there's a lot of serious conditions that can have gas associated with them, like colon cancer or inflammatory bowel diseases like Crohn's disease can actually present with gas. So if you've got that symptom, you need to talk to your doctor.
How do you prevent it?
That's a tough one. Really one of the best things you can do is watch your diet. So usually a certain type of food will trigger gas in most people, and so you really need to avoid that food. But another thing that's really important that not everybody does is slow down a little bit. The faster you eat, the more likely it is that you're going to ingest gas as well, pulling air into your stomach. So if you actually just slow down and chew a little bit slower, then a lot of times that can ease the gas pains as well. And then another thing you can do, especially if you have difficulty with dairy products, a lot of adults in particular, are lactose intolerant. And so you can actually buy dairy products that are usually sold under the name Lactaid or Dairy Ease. They actually have a specific enzyme in them that helps your body digest the dairy a little bit better. There are a couple of over-the-counter medicines like Gas-X that can help rid the gas, but keep in mind you can't really get rid of the gas. What you can do with Gas-X is kind of pull it all together into one big gas bubble, but then you still got to get rid of it somehow. I
would take a break, talk about stomach pain when we come back. Dr. B, our guest, Chief Medical Officer of People's Health, talking senior health as we do every Thursday morning at this time. 8:21 traffic now, WWL. 8:25, I'm Tommy Tucker, WWL Thursday morning. That means we talk to Dr. B, our friend Dr. Brent Wallis, Chief Medical Officer of People's Health, about senior health, although today's topic really is for everybody. We're talking about the digestive system. When it comes to stomach pain, Doc, not the kind that you use to try to get out of a test in fourth grade, but real stomach pain. Talk about that, if you will, please.
Yeah, everyone experiences stomach pain at some point in their lives, and some more often than others. And usually, it's related to either lifestyle or your diet. And like we've been talking about, you can usually modify your diet or use some over-the-counter medications help with that. But you have to kind of watch out, if it's something more serious, if it's continuous abdominal pain, that's when it's kind of a red flag. The most common causes, like we were talking about, reflux disease is very common, indigestion, lactose intolerance. But in addition, actually, people who suffer from constipation can actually get pretty severe abdominal pain. People who have stomach ulcers as well can actually have pretty severe abdominal pain. And like I mentioned, it could be, a sign of something more serious, something like an inflammatory bowel disease. It could even be a hernia or infection. Urinary tract infections in particular can cause some abdominal pain as well. So what I usually tell people, a day or a night with some abdominal pain that goes away on its own, or with just some simple diet modification is nothing serious. But if you're having it real frequently, certainly if you're vomiting or having severe diarrhea or any sort of blood in your bowel movements, that's when you need to talk to your doctor.
What about stomach health? We see so much on TV with probiotics and the gut, et cetera. Can you kind of walk us through all of that?
Yeah, it's a little complex, but probiotics have really been popular in probably the last 10 years or so. And the important thing to remember is that your stomach has your entire digestive tract has bacteria in it, but it's good bacteria. It's bacteria that's needed to help digest and break down the foods. And sometimes if that bacteria balance of the good and bad bacteria gets out of whack a little bit, then probiotics can help. And really what they're supplements that are actually live microorganisms. Usually it's bacteria and yeast. Some of them are dried. Some have to actually be refrigerated because they have live organisms in them. And the most common one is called lactobacillus. That's what you find in yogurt most often. And they can also be found in other foods, miso in particular, some juices and soy beverages. And if those foods are really not in your diet, or if you're having a lot of trouble with abdominal pain, your doctor may recommend that you take probiotics. The really important thing to remember is that they are a dietary supplement. They're not a medicine, so they're not regulated by the Food and Drug Administration, and they can interact with other medications that you're taking. So if you're on medicines and you're having abdominal problems, then you'd want to talk to your doctor before you go pick up probiotics at the drugstore.
So you said they spend a month on this in medical school, and I can see how, but if you could wrap it all up, what would you like us to kind of take away from today's conversation about the digestive system?
Yeah, I think the biggest takeaway really is eating healthy is so important. There's so much that you can do to avoid stomach problems if you really just eat a good diet and kind of pay attention to what makes you not feel good. And if you don't feel good after eating a certain type of food, even though it may taste great, then you probably should avoid it or eat it in very small amounts. Like we were talking about, probiotics can definitely be very useful as a supplement, but you definitely need to make sure that you talk to your doctor if you're taking medications so that they don't interfere with any of those medications. And then really probably the most important thing to remember is that it's very common to have all of these stomach problems, but if they are lasting a really long time, if they're really debilitating and causing problems for you and the over-the-counter medications aren't working, talk to your doctor. It's very important. And I'll put one plug in for our seniors, get your colonoscopy done, because we're seeing a huge drop-off in colonoscopy screenings as well, and that's an important part of digestive health to get screened for cancer.
At what age do you start that, Doc?
So you start that at age 50, and right now there's some recommendations for people to go down as young as 45. So talk with your doctor to see when you're eligible for it. But it's a very easy test to get done and can really, really save your life.
Good information. Thank you, Doc. Hope you have a great weekend. We'll talk to you next Thursday.
Thanks, Tommy. You too.
Yeah, to find out more about People's Health, you can go to peopleshealth.com/radio. You can call 866-687-7335. You can always follow People's Health on Facebook, Twitter, and Instagram. Time now, WWL.